Hello, everyone, and welcome to week 6. This week, we will focus on risk and crisis assessment, which is one of the most critical responsibilities counselors may encounter in clinical practice. While these situations can feel challenging, developing competence in risk assessment is essential for protecting client safety and providing effective care. Risk assessment involves evaluating whether a client may pose a danger to themselves or others and determining the appropriate level of intervention. One of the most common and serious concerns counselors assess is suicide risk. When conducting a suicide risk assessment, counselors often explore several key areas. These include whether the client is experiencing suicidal thoughts, whether they have a specific plan, access to means, and whether they have expressed intent to act on those thoughts. These questions help counselors determine the level of risk and guide decisions about intervention and safety planning. At the same time, it is important to identify protective factors. Protective factors are aspects of a person's life that reduce the likelihood of harmful behavior. These might include supportive relationships, coping skills, spiritual beliefs, or personal goals that provide reasons for living. Risk assessment may also involve evaluating the potential for violence or aggression toward others. Counselors may consider factors such as past behaviors, current stressors, and situational triggers that could increase the risk of harm. Another critical area of risk assessment involves recognizing signs of abuse or neglect. Counselors working with children, vulnerable adults, or other at-risk populations often have legal obligations as mandated reporters. Understanding these responsibilities and the appropriate reporting procedures is essential for ethical and legal practice. Although these conversations can feel difficult, research consistently shows that asking direct questions about suicide or harm does not increase risk. In fact, open and compassionate discussions often help clients feel heard and supported. Another important component of risk assessment is understanding that risk exists along a continuum. Not every client who expresses distress or hopelessness is experiencing the same level of danger. Counselors must carefully evaluate multiple factors to determine whether a situation represents low, moderate, or high risk. For instance, a client who acknowledges passive thoughts such as, quote, I sometimes wish I could disappear, unquote, may require a different response than someone who reports a detailed plan and immediate intent to hurt themselves. Assessing this continuum allows counselors to determine appropriate next steps, which might include safety planning, increased supports, consultation with supervisors, or referral for emergency services. It is also important to recognize that risk assessment is not a one-time conversation. Client safety should be revisited throughout the counseling process, especially during periods of significant stress, transition, or emotional escalation. Regular check-ins help counselors remain responsive to changes in a client's emotional state. Approaching these conversations with calmness, empathy, and directness helps create a space where clients feel safe discussing difficult thoughts and experiences. The goal of risk assessment is not only to identify potential danger, but also to develop safety plans and connect clients with appropriate resources and support systems. As you move through this week's material, consider how developing confidence in these skills can help you respond effectively and compassionately when clients are experiencing moments of crisis. Thank you.